Today we'll be discussing about pneumonia. So what is pneumonia? Pneumonia is basically the inflammation of the lung, right? One or both, maybe, right? There is infection and inflammation of the lung, parenchyma. So it is of two types, typical and atypical. Before that, pneumonia cause there is inflammation in the alveoli. That's why there is difficulty in breathing due to filling of fluid or pus in the alveoli, right? So in case of typical anemia, in case of typical pneumonia, there are signs and symptoms both present. But in case of atypical pneumonia, the signs and symptoms are mild or maybe absent, right? So in typical pneumonia, productive cough is there. There is increase in TLC, fever is there, and consolidation is there. But in case of atypical pneumonia, there is congestion, without consolidation. Whereas in case of typical pneumonia, there is congestion with consolidation is present, right? Because of presence of alveolar exudates, right? So inflammation and consolidation of lung tissue is due to infectious agent. So consolidation is equal to inflammation, induration of normally aerated lung due to presence of cellular exudate in alveoli. That means there is alveolar exudate, right? So microorganisms mainly present are, in case of typical one, pneumococcus, streptococcus, pneumonia, right? In case of atypical one, cause may be viral and mycoplasma, right? Sometimes this is maybe due to chlamydia, legionella, and in case of legionella, there is fever, high grade fever, and with diarrhea, right? And other causes of this typical one is H. influenza, S. aureus, pseudomonas, right? So just remember pneumococcus, streptococcus, pneumonia, right? So how does this pneumonia develop? Basically, most of the time the body filters organisms, but when these organisms get into the lungs, these keeps the lung infected always if there are organisms, but the organisms and cause infection. This is more and more likely to weak immune system. Organism is very strong, body fails to filter the organism. Generally, body filters the organism, but sometimes there is no filtration, right? So basic factors, as we all know, cigarette smoking, upper respiratory tract infection, alcohol, corticosteroid therapy, old age, right? Influenza infection in case of H influenza. Influenza, there is H influenza, pre-existing lung disease, right? These are the factors, those are predisposing to pneumonia. So let's discuss about the pathology. There is congestion, presence of proteinaceous exudate, and often the bacteria in the alveoli, right? And sometimes there is red hepatization. That means the lungs looks like the liver. Presence of erythrocytes in the cellular intraalveolar exudate. Neutrophils present. Bacteria are occasionally seen in culture of alveolar specimen collected, right? So these are the pictures of normal lung and red hepatization. So anatomical classification, the pneumonia are of bronchopneumonia type, which affect the lung in patches around the bronchi. You can see the patches over here. Just remember this, right? Patches in the lungs. And second, patches like this, right? Here you can see the patches over here, right? And second one is lobar pneumonia, is an infection that only involves a single lobe or section of lung. That means this lobe is infected, right? So this is mainly due to reduced immunity, right? Main factor. This lobar pneumonia has 4 staging. Lannett staging, right? In first stage, there is congestion, right? Second is red hepatization. That means it looks like a liver-like consistency is there due to hemorrhage. Then third one is gray hepatization, right? Which is due to fibrin. And fourth one is due to resolution, right? Now, according to clinical classification, there is community acquired, atypical, typical, and aspirational. So community acquired is mainly due to pneumococcus, right? And pneumonia in elderly, nosocomial, that means hospital acquired infection, ICU acquired infection. This develops due to methicillin resistant Staphylococcus aureus, very, very important. Or maybe due to Pseudomonas. If both are present in the question, so opt this one, methicillin resistant Staphylococcus aureus. Second option is Pseudomonas always, right? Then third one is Legionella, right? Then is pneumonia in immunocompromised host if immunity is low, right?